So welcome back everyone. In this segment we will cover the assessment of systemic lupus erythematosus and the treatment. Again I am telling there is I don't think a single lecture or two lecture or can be done covering the whole aspects of SLE. It's simply impossible. We have discussed previously, this is a multi-system disease, affects many organs or systems in the body. So this is not possible. For the assessment, there is a we might call it a questionnaire or tool which is known as systemic lupus erythematosus disease activity index, Selena modification. So in short, this is known as SLEDI. SLEDI means systemic lupus erythematosus disease activity index. So in SLEDI, the first point is physician's global assessment, where there is score 0, 1, 2, 3. 0 mean none, 1 mild to moderate or medium, and 3 is severe. So first criteria is physician's global assessment, how the physician is assessing the patient. And then we have to have around 24 to 25 criteria with different weight. What is the different weight? Say if one symptoms is present, that symptoms will be weighted as with a number of 8, say 8. If another symptoms is present, it will be numbered as 4, so the weight is less. If another symptoms is present, the number of weight will be 1, so this is much lower. So according to this weight, we will have to, this is a very simple method, though it seems like that there are 24, 25 items in here, but this is simple because we will have a printed sheet or we might do it in a laptop or a computer, where we will have to only click or give a tick marks to the symptoms or the findings we are having. After getting all those things, we have to calculate the total sum of symptoms or findings, and we will get a number. That number will give us an idea about the severity of the disease. So first of all, physician's global assessment, and there are the parameters. So what are the parameters? Again, these parameters is extensively described in the SLEDI scoring system. If anybody wish to know about SLEDI, you just have to click your, as we are having an online class here, if you can attend the class, you can easily find the SLEDI assessment tool in the internet, where the descriptors are very well described in the SLEDI scoring system. So if the description is present, we just have to click that, and with the weight is also given in the chart. So we just have to click or give a tick marks to the symptoms, and then have a summation of the weighted numbers, and we will have a value. That value will tell us the severity of the disease. So I will just tell the name of the descriptors. These are seizures, psychosis, organic brain syndrome, visual disturbance, cranial nerve disorder, lupus headache, cerebrovascular accident, vasculitis. So here are 8 descriptors, 8 points. These 8 points having weighted number of 8. So if any of these 8 points is present, any of these 8 point patient is suffering from any of these 8 point is diagnosed, we will have to the weight of that symptoms will be 8. Again, let me repeat these descriptors: seizures, psychosis, organic brain syndrome, visual disturbance, cranial nerve disorders, lupus headache, cerebrovascular accident, and vasculitis. So these 8 having a weighted number of 8. Then what are other descriptors? These are arthritis, myositis, urinary cast, hematuria, proteinuria, pyuria. So we are having another 6 items here. What are these? Arthritis, myositis, urinary cast, hematuria, proteinuria, pyuria. These 6 items contains marking of 4. So if any of these are present, we will have a point of 4. Then there are other parameters like new rash, alopecia, mucosal ulcers, pleurisy, pericarditis, low complement, increased DNA bindings. These points having a score of 2. So what are these? New rash, alopecia, mucosal ulcers, pleurisy, pericarditis, low complement, increased DNA bindings. These 7 criteria having a point of 2, and there are 3 criteria having points having 1 points like fever, thrombocytopenia, leukopenia. So if we count the numbers, there are 8 points having 8 points, 8 parameters having 8 points. There are 6 parameters having 4 points. There are 7 parameters having 2 points, and there are 3 parameters having 1 points. And after checking these parameters, we will have to sum the weights next to the descriptor and having a total score. Then how will we interpret this? In case of we have to decide on flare, if the SLEDAI change is more than 3 points, then mild to moderate flare, and if the SLEDAI change is more than 12 points, the flare is severe. So depending on the flare, we have to decide how to treat the patient. So what does that mean? Mild or moderate flare means changing in SLEDAI point. We will have a basic SLEDAI. When we have diagnosed the patient with SLE, we will have a first SLEDAI, and then subsequent follow up we have to assess whether this SLEDAI score is increasing or decreasing. If increasing by more than 3 points, mild to moderate flare. If increasing by more than 12 points, is severe flare. Then our treatment decision will be based on SLEDAI score. Not only actually SLEDAI score, which organ system it is involving, that is also very much important in case of decision making. So how to manage? The management sector, mild to, if the disease is mild to moderate, we in many instances we can manage the patient with analgesic, NSAIDs and hydroxychloroquine. Glucocorticoids might be necessary in low doses like 5 to 20 milligram per day or less than 0.5 milligram per kg body weight. In many instances, methotrexate or mycophenolate may be given. Belimumab is a treatment option. In severe or life-threatening cases like renal disease, central nervous system disease or cardiovascular involvement, high dose glucocorticoids and immunosuppressants should be given. Maybe commonly used regimen is pulsed methylprednisolone 10 mg per kg body weight plus cyclophosphamide 15 mg per kg. Repeated cyclophosphamide is repeated 2 to 3 weekly or for 6 cycles. In fact, sometimes as an alternative, mycophenolate mofetil also used, and belimumab may be also given. In case of this regimen is designed to treat the acute flare or flare of the disease. After the treatment of the flare of the disease, there has to be a maintenance phase where oral prednisolone is gradually reduced. It might take months or even years to reduce the prednisolone and subsequently withdraw the prednisolone. For the maintenance therapy, we might use azathioprine, methotrexate or mycophenolate mofetil. In the long term aim is to continue the lowest dose of glucocorticoids and immunosuppressant to maintain the remission. So, what is the goal of the treatment? The goal of the treatment is to have a remission with the lowest possible doses of steroids and immunosuppressive agents. If there is comorbid conditions like hypertension and hyperlipidemia, should be treated accordingly. If there is in lifestyle advice, we should advise the patient to stop smoking and the healthy habit of lifestyle. If a smoker stop smoking, exercise and other things. So, in case of management, what is the basic idea? I am repeatedly telling one thing: management of SLE cannot be described in a lecture and maybe in many lectures, because there is a book entirely, there is almost 1000 pages book based on systemic lupus erythematosus. So, what is the idea? If the disease is mild or moderate, we can simply use NSAID or any analgesics and hydroxychloroquine can be given, and in many times this is sufficient to treat the patient. If the patient is severe and there are important organ is involved like CNS, CVS or renal systems, then we have to give steroids, initially maybe high doses 1 milligram per kg body weight, then reducing the dose over a period of 1 year or 2 years maybe, depending on the response of the patients, and starting an immunosuppressive therapy along with hydroxychloroquine. For immunosuppressive therapy, we might choose cyclophosphamide or alternatively mycophenolate mofetil or belimumab. Everything will be depend on the clinical scenario and findings of the patient, of that individual patients. So, after getting the disease controlled or patient in remission, there will be a maintenance course. What is the idea of the maintenance therapy? To keep the patient in remission with the lowest possible dose of steroids and immunosuppressive therapy. And there has to be some lifestyle modification advice. If the patient is smoker, patient should stop smoking, as there is added cerebrovascular and cardiovascular risk, lipid lowering agents may be required. So, other lifestyle modification like increase of vegetable intake, decreasing of fat intake and regular exercise will be very much helpful. So, considering everything, in short, this is the idea of how to assess a patient of SLE and how to treat a patient of SLE, how to manage a patient of SLE. Though this is a very complex topics, and in many instances a collaboration among the colleagues of various disciplines is required. A multidisciplinary approach might be required to treat a patient of SLE. I think with these lectures we might have an understanding, we might have an overview how to diagnose a patient of SLE, how to manage a patient of SLE. At least if with these two segments of lecture, if we can understand when to or how to suspect a patient of SLE, I think I would consider this two lecture as a success, if we can at least suspect that the patient might be suffering from SLE. So, with that note, thank you everybody.